Coming up on ER Vets.
The fang tooth is really broken.
Oh, she really wrecked it.
I think he might be fading. He hasn't had the opportunity to maintain regular walks.
Oh, it's quite the movement of the eyes.
Seeing them like this, I'm worried.
Toronto, home to the VEC, an emergency veterinary trauma center. With over 200 employees and more than 20,000 patients a year, the VEC is one of the busiest veterinary facilities in the country. These are 3 of its cases.
So I had a phone call from Dr. Chris Dutton at the zoo, and we have kind of an exciting case today because they've got a 6-year-old female cheetah whose name is Pinky, and the keepers noticed that she has a broken tooth. Now that's all they've been able to see. Chris sent an email with pictures of Pinky's broken tooth, so we're going to go have a look and see if it's something we can fix. Oh, okay. The canine tooth, the fang tooth is really broken.
Is that the pulp there,
right there?
Dot?
Yeah, so that's dead.
So you're gonna have to pull it or do a root
No,
canal?
I think she's only 6, so I think that it looks to me like there's enough tooth there that we can do a root canal. I'd rather do a root canal than pull it. We don't really know how she broke the tooth. You know, they just noticed it, so there may be other damage. So I guess we'll find out when she's asleep, and we'll just have to be prepared for any eventuality, I guess. All right, well, let's get going, and then we'll see what happens.
Awesome. Okay.
All right.
As Dr. French prepares to dash out to the zoo, across the hall a golden retriever comes in for rehab.
Hey, Delita. Hey, good morning.
How are you?
Good, how are you?
Good to see you again.
Nice to see you. My name is Delita Negrin. I am a canine massotherapist, and I work at the Animal Rehab Center. Today we have Brody coming in. Hi, Brody. He's an older arthritic patient.
My name is Wendy, and I'm here with Brody, my 12-year-old golden retriever, and we're going to be doing some aquatherapy work, a dog massage, and then an acupuncture session with Dr. Pettifor.
You ready?
Yeah, he's doing good.
He's doing good. He looks great.
He was a really healthy dog up until about 2 years ago. He was diagnosed with cancer. With his diagnosis, he was given 2 months to about 100 days to live at that point in time. And we did chemotherapy for 3 months, maybe 4 months. His reaction to the chemotherapy was quite severe, and he was quite sick after that. His quality of life was really suffering. So we decided we'd cease chemotherapy. And we really did think that that was going to be his death sentence at that point in time. That we've had another 15 months makes you really appreciate what they bring to your life.
He's had a lot of muscle loss and hasn't had the opportunity to maintain regular walks. So we do the treatment in the hydrotherapy tank to help regain range of motion, strengthen muscle mass. Being in the water, it takes the stress off the joints. Well, I think he looks pretty good, but I think he might be fading a little bit on us. We'll cut it short then today, and we'll supplement the rest with a little more massage.
Sounds good.
That was great. What a good job. Good boy. Well, I think he heard me say massage and decided he was going to stop moving.
I think so too, yeah. No more swimming.
All right, let's go, sweetheart.
As Delita takes Brody to prep him for a relaxing massage, over at the zoo, Pinky the cheetah is about to be darted in order to begin her procedure.
So today we're up at the cheetah house here. We've got a cat here that has a chipped canine tooth. Her name's Pinky. She's a 6-year-old African cheetah. We're very fortunate. Dr. Sharon French is coming in to help us this morning, and in a minute we're going to go in and anaesthetize this cat. Could you just pass me the blowpipe thing? We're not certain how it managed to break the tooth, whether it was chewing on a large bone, whether it jumped and hit something. We're not certain. Okay. We went up to anaesthetize her. We did that by darting her with a couple of anaesthetic agents. The aim is to get it into the muscle deep enough so that the injection can be absorbed well without causing any damage with the actual dart. The darting was good. It went into her thigh nicely. None of the animals particularly appreciate being darted, just like we don't appreciate having a needle ourselves. She went down very quickly, which was great. We got her all set up and ready to go. We put her on a stretcher and brought her back to the health centre and have the procedure performed.
With Pinky successfully anesthetized and on her way to the Animal Health Center, back at the VEC, Dr. James has been given an eye-popping emergency case.
So a dog just came in from the emergency service. His name's Max, and he's a little old dog with a sudden onset of vestibular signs, meaning his equilibrium is off and he's off balance.
So Max is a 14-year-old male neutered Shih Tzu. It's quite the movement of the eyes.
My name is Anne, and I've brought my dog Max in, came home from work. I noticed he wasn't quite walking normally.
You know when you're driving the car and you're looking out the window and your eyes are ticking to keep up with where you're sort of falling towards or moving towards? When we look at him stand up, he's got this lean over to the left side because he feels like he's falling that way. Poor little guy must be really dizzy.
We joke and say if Max were a human, he'd probably be put in jail for stalking me. He's supremely attached to me. Anywhere I go, he's with me. So he's sort of been my baby.
She didn't notice an abnormal eyeball movement until she came here this morning through ER, and a technician pointed it out to her.
Oh, so all she noticed was the head tilt and the wobbliness, and it started acutely
Last night.
When that happens in an old dog, the most common thing we see is a thing called old dog vestibular disease, and that's not a very serious condition. It's a benign condition.
And it improves?
It improves, and they get usually 100% better, but sometimes they can have a little bit of a residual head tilt. Okay. But he could have something else, like a tumor in the area of his brainstem, or perhaps a stroke. I can't rule it out by looking at him. We can only rule it out by imaging his brain. The next question is, should we or should we not image his brain at this point?
So what is your professional opinion?
My professional opinion is that we should wait. If it's okay with you, I'd like to admit him and put him on IV because they don't want to eat and drink sometimes. So what we're going to do is just hospitalize him, and we're going to just watch him through the day. If he's improving, then it's more consistent with old dog vestibular disease. And if he's not improving, then I'm going to recommend that he has an MRI of his brain so that we can make sure that there's no presence of tumor or stroke.
We had to put his brother down in April, and I'm so worried. I can't go through that again. They both were just best friends. Now seeing them like this, I'm worried. I don't want to say goodbye to him yet.
Coming up on ER Vets.
Dogs tend to hold a lot of attention in the neck and the shoulders.
I was a little apprehensive about what we'd find today. The tooth was badly infected.
He's much more wobbly. It's not great news.
Before the break on ER Vets, Dr. James tested a dog with serious balance issues, Pinky was prepped for his dental procedure with Dr. French, and Brody began an important therapy session.
Are you ready for your massage?
Next, we're going to massage therapy. There are people who think I'm crazy that I've got my dog having massage therapy, but there really is a true benefit, and he absolutely loves it.
So you know when you work out and you find your muscles are really sore?
Okay.
It's because of the lactic acid buildup. Rehabilitation is something that not only humans go through, but so do animals, and a lot of the same principles will apply. I am gonna start off by working in the neck region, because much like humans, dogs tend to hold a lot of attention and stress in the neck and the shoulders. We're just gonna relax Brody and just get him comfortable.
He looks fairly
Doesn't
relaxed.
seem to mind.
Does that feel good, hon? Does it? Yeah, I have to admit, I think my dog gets better treated than I do now because he does have more massages than I think most people do these days.
Brody is very, very close to her. She would do anything and everything to try to make his life as good as possible. Her love and affection for Brody is so genuine, and she is as much of a part of the treatments as we are. Oh my goodness.
I think you've got a good
He's
spot.
gone from relaxed to like really, really happy. I think Brody might be ready to do the other side. What do you say?
Absolutely.
Yeah.
While Brody continues to enjoy his doggy massage, back at the zoo, Pinky is ready to have her tooth fixed by Dr. French.
So I was a little apprehensive about what we'd find today with Pinky, because sometimes when we have to do root canals in these large cats, they're several hours long, so I get myself a little bit prepped for that.
Oh, she really wrecked it.
Did she?
It's root canalable, so
Yes,
that's
good.
happy.
That's good. Not extractable.
No.
Very good.
That's a 4-letter word.
Pinky did indeed have an abscess on her canine tooth, and certainly that tooth would have been fairly uncomfortable for her.
So she doesn't really have very much left of her tooth, but when you look at it, that's the root. So that's pretty long.
The pulp, or the soft tissue center of the tooth, was very badly infected.
And clean all of that material out.
It was kind of a black sludge and smelled really bad.
Ooh, that does not smell good. So you're left with a hard structure with a hollow core, and we need to fill that with something because the body always wants to seep fluid in there. So we fill it with an inert material called gutta percha. So we heat it up, and then we shoot it in with the gun. It's a very long canal, and so sometimes these things are a little tricky to get the whole thing with a solid fill. So we want to make sure that the whole canal is really packed full of this gutta percha, which looks white on the x-ray. I'm actually having a pretty good time. Well, I shouldn't say that until I see the x-ray. I'll see the x-ray, and if it's good, I'll tell you what a clever veterinary dentist I am.
Dr. French performs an x-ray to check her work, while back at the VEC, Dr. James looks in on Max.
We had a look at him, and unfortunately he doesn't seem to be getting any better. His head tilt is just as pronounced, if not a little bit more, and his eyes are just as bad as they were. The way he's walking is a little bit worse. He's much more wobbly, staggering and falling. This lack of improvement is not really consistent with old dog vestibular disease. If anything, he's a little bit more tilted than he was, which makes me worried that we're dealing with something potentially involving his brainstem. We'll call Mom. We'll see whether she's willing to do an MRI on him, and that way we'll be able to look and see whether there's anything abnormal in his brain or brainstem that could be causing this. We'll give her a call now and see what she wants to do.